morning. I hope you're all able to hear me. I'm Pallavi Jain, and I'm lead for YO.DH, which is Youth Ownership of Digital Health. And welcome to all of you for our design thinking workshop for today. We are doing this introductory design thinking workshop today so that you guys can have a taste of how design thinking can be used in healthcare, how it is being used already, and to give you an idea of the different steps of design thinking and how can you go about using design thinking in your ventures and the work that you do. Before I hand over the floor to my colleagues, I would quickly like to introduce you to Saathi Ventures, as well as Design for Impact, our partners for today. So Saathi Ventures is an impact venture building firm that builds and supports youth-led ventures geared towards solving pressing issues. Himanshu started Saathi Ventures in 2019, and his day-to-day job is to support entrepreneurs and innovators in their early-stage startups. Design for Impact is a design and research company specialized in graphic design, industrial product designing, and skilling. Prathamesh Mahajani is the founder of Design for Impact and a gold medalist from National Institute of Fashion Technology. As a designer, researcher, and engineer, he loves to design for social good. And Prathamesh is also going to be our facilitator for the day. I'm sure you all are aware of what YOD is. I'll quickly take a moment to tell you guys a bit more about it. So YOD, or Youth Ownership of Digital Health, is a volunteer-led community of professionals in digital health space under the age of 35. We have 6 initiatives that we offer, including YOD Charcha, as well as other initiatives such as field visits, events, webinars, so on and so forth. This is a place where you can connect with like-minded people who are working in the digital health space, and you can learn from them, you can network with them, and you can just build a beautiful future in digital health together. In case you're not a member of YOD or want to follow us on our social media or want to know a bit more about us, we are pasting a link in the chat. You guys, please click on the link and you can follow us. Now I am going to pass on the floor to Prathamesh, who is now going to take you through design thinking.
Thank you so much, Pallavi, for the introduction. And I can see some people already with the wishes, good morning wishes on the chat. Glad to see the crowd. I would quickly, before getting started, want to know if my voice is clear. So you can just text in the chat box, yes, if it is clear. Okay, thanks a lot. That's a good validation for me. I'll share my screen quickly. Before I get into what design thinking is and all those interesting stuff that you are here for, I would like to thank Saathi Ventures and Youth to help us come on board, help us all come together on this day and um, connect over a design thinking workshop or introductory design thinking workshop. About Design for Impact, we are an organization that is committed to drive positive change in the society, and we do it through design. We are a team of entrepreneurs, engineers, designers, and illustrators, and we look forward to bring social innovation in healthcare, but through design and design thinking. So before we get into what it is, I would like to know some ideas or some preconceived concepts you might have about what design thinking could be. So I would give everyone around 15 seconds to let us know what it is. Don't submit your text yet. Wait for a call from me. I will let you know when to submit your answers. You have 15 seconds to give your idea about what design thinking is, and you can start now. I will tell you when to submit your answer. You have 15 seconds. Okay, 3, 2, and 1. You can submit your answers if you have any thoughts about what design thinking is. So I can see Sharan Murali's message that says thinking in terms of what design will best fit the users. Interesting. It's a problem solving methodology as per Nimisha Bhuyan. Now tell you what design thinking actually is. As per IDEO's definition, IDEO is an organization that works that has coined this term called design thinking in the first place. So it's a problem solving approach that emphasizes human needs, human centered design approach, and it's a very iterative process to solve complex problems. When I say complex problems, they are the wicked problems in the society which are not existing in isolation. They exist in connection with many other problems altogether. That brings me to another question for all of you. Can you think of instances when you thought of solving problems in the healthcare for your loved ones or even for yourself? Have you tried to solve anything on your own or thought about an idea to solve any particular problem? And did anything stop you from solving those problems? So again, I'll give you 15 seconds to type in whatever your thoughts are. And once I tell you to submit, you can share your answers. And your time starts now. Okay. 3, 2, and 1. If you have any ideas in mind, anything that you have thought about, feel free to let us know. So, Agrima has said accessibility, asymmetry of information, lack of required infrastructure. Okay, I'm assuming you're talking about it in terms of healthcare. Um, Dr. Rucha Wankhede says it's sometimes difficult to get the message across, especially if it's too technical and requires jargons. Very true. And I'm from a non-medicine background, or I would say very much isolated. I used to be very much isolated being a designer from healthcare, but it took me some time to understand certain jargons in healthcare. It definitely is a challenge. Yes. I had tried solving health illiteracy through educating my patients in OPD via HE materials. Um says Tamizanban. A. Aditya says lack of reference. Okay. Lack of awareness about health programs in India. Yes, that is a very interesting problem to have and to solve in the first place by Asifa. Um, Booking a teleconsultation for my grandparents. What stopped me was explaining to them what teleconsultations are and bridging the gap of proximity. Yes, very interesting, especially when it comes to elderly technology and getting used to the phones in these days is definitely a big gap to be filled, to be bridged. Great. So I will walk you through one case study. Okay, there are more answers. Most problems require multidisciplinary approach, and one might not might be well in all domains. D. Tejaswari Naidu, this is a very interesting point, and we will take this forward in the coming slides. A very interesting point. Elderly issues, yes. Who are the first contact point? True. So we'll go quickly into one interesting case study that I have for you, wherein one interesting stakeholder was the segment of kids, uh, and here the problem was identified by IDEO, which worked with Oral-B, uh, which all we all are very much aware about in toothbrush and toothpaste industry. Now, what Oral-B wanted to do was they wanted to redesign toothbrush for kids. There was no initial research done by them, so they hired an agency called IDEO. It's a design thinking firm. They do much more than that. What they did was they studied the brushing techniques of children. And while they were at it, they observed that kids at their age, when they are given toothbrush that we adults use, which are very slim, it becomes difficult for them to hold the toothbrush because their fingers do not have the dexterity or the sense of control that we as adults start having as we grow. And what they do is they hold the toothbrush in their fist. They basically grab the toothbrush and then they maneuver it to do the brushing of their teeth. And this made it very difficult for the children to use the conventional toothbrushes for their brushing purpose. For you to understand, even in the simpler terms, think of it: you are driving a car, you have the steering in your hand. The steering's the steering wheel thickness is designed in a way that it fits well in your hand so that you can maneuver your car better. If your steering was just a wire or just a very thin sheet of circle, it would have been very difficult for you to hold it, grab it, and control your car by maneuvering the steering wheel. That's the same principle here. They realized, and with that they thought that let us come up with solution that basically solves this problem for kids. What they did was they increased the diameter of the grip. They made it a bit more interesting for kids by adding textures to it. Now, addition of textures also makes sure that the grip gets even firm, and it also makes it very interesting for the children um, to use it in the first place, which is also for brushing, which is like the very basic activity of our daily living. So they came up with a brush which had a fat grip, and this made the revenue of Oral-B almost multifolds with just this small change. This was the story of Oral-B and IDEO, and the product that you're seeing is their solution or innovation that brought a huge change not only in the kids brushing industry but also in terms of revenue of the whole organization as a whole. Um, we'll go to the next question that I have for you. Have you ever been to a blood donation camp, and have you ever faced this difficulty where the health expert was not able to locate your vein? It could be you, or if anybody you went with and you have seen someone face this problem, please let us know. You can directly answer this in terms of yes, or if you have any interesting incidents, please do share them as well. You have 15 seconds again to do the same. Okay, three, two, one. Um, Anybody who has any interesting incidents also can let us know. There are two yeses, three yeses. Oh no, there are more actually. Um, I'm scrolling it. Aditi says yes. Pallavi says yes. Narayan Shri is saying yes. Shambhavi. Multiple pokings and being told that veins are too thin. Very true. Especially for people with thick skin or people who have a different color of the skin, it becomes difficult to find the veins. Um, Aditya says, my friend is obese and the nurse couldn't locate the vein, and many times they puncture the layers, causing hematoma as they are not experienced. Yes, that is true, especially in the tiny babies and elderly. You guys are completely on the right track of observing the challenges that we are going to talk about. And multiple pokings and being told that veins are too thin. Yes. So, so the next case study is about this particular problem. And as you see, this was done by IIT Bombay students and under the guidance of Professor Chakraborty. He is a very famous designer, industrial designer, and facilitator or teacher. You should definitely check out his work. And this was under his guidance that these students came up with. The problem that they identified was the same that we talked about. It was difficult to extract blood, and it led to multiple pricks, which also leads to a kind of trauma on the patient, and especially children or elderly, like someone mentioned. It becomes difficult to go through these scenarios, and this happens in a lot of cases. So the students of design, they came up with an interesting solution to solve this wicked problem. And what they did, technique their infrared spectroscopy. As you can see in the picture here, there is a very perfect device which is given. It emits LED light. This LED light is detected by the deoxygenated that is flowing through the veins. And okay, Aditya says my voice is not audible. Give me one sec.
Pratmesh,
Is
now
it
we can hear
audible
you
now?
properly. Yeah, now we can hear you.
Okay. Okay, I've switched off the video for now, so that the bandwidth is saved. Yes, I will definitely repeat. Um, so the problem that we talked about not being able to identify the veins properly for elderly, for kids, for people who are obese, it becomes very difficult and traumatizing to go through this simple process of extracting blood. And at some point, all of us feel really proud of donating blood, so we all want to do it. And if in such situation we are faced with this kind of barrier, it becomes very difficult. So the problem was identified by these students, and the product that you see, it was designed under the guidance of Professor B.K. Chakraborty, and he is also a teacher at IIT Bombay. You should definitely check out his works. As you can see in the image, they use a technique which is called NIR spectroscopy, near infrared spectroscopy. What the device does is it emits LED light, and this light is deflected by the deoxygenated blood flowing through your vein, and that basically creates a silhouette, a dark looking line, which essentially is the line on which the syringe is to be put, and your problem of being not able to identify the vein gets sorted by this particular device. And this is also a device which is very cheap, affordable, and it is portable, so one can carry it with them. So this was one interesting case study which I wanted to talk about based on the problems which all of you have seen. One more point which I would like to talk about here is the right side shows different prototypes. What are prototypes? They are the iterations made in terms of the form of the design, in terms of the functionality of the design. And the way they are made, as you are able to see, is made out of foam and different materials that allow us to make these kind of products. And you can also get it user tested through prototyping the same. Agrima has asked how widely is this being used currently. Agrima, I don't have the information about it at the moment, but you can check this product out on IIT Bombay's website and get more idea about it. It could be that there are more products also, or there are similar products or similar innovations which are done by others also existing in the market. Um, Coming to the next question now, how often do you Google disease symptoms for yourself or for your loved ones? Does the Google search, give you the desired results? And um, you have again 15 seconds to answer this. I'll let you know when to push your results. So you can take 15 seconds to start writing, and I'll tell you when to submit those answers. In the meantime, I'll just read Sharon's message. From the implementation point of view, it's most used by some corporate hospitals only at rare occasions, not in the general use case. Thanks so much, Sharon, for that. Okay. 3, 2, and 1. You can submit your answers almost every day. Okay. Sometimes I keep away from and also just the same to family and friends. Seems like tricky bridge to cross, says Agrima. Pallavi says pretty much always Google gives accurate info at most times, but it isn't personalized and is an information overload often confusing. True. Aditya says Google searches are never accurate. All the symptoms lead to cancer or something. There is a stand-up comedy on this, and I totally agree with Aditya on this. If the prompt is right, then yes, sometimes. Yes. Almost every time when someone tells me about their experience of their illness, Asifa also does this sometimes. So thank you for your interactions and very quick answers on this. We are going to talk about something that is very much relevant to this particular problem that we all face today. This brings me to the next case study by Ada Health. Um, and this is an application as opposed to the other solutions that we saw before. This is more intangible. The previous solutions were more like tangible, industrially designed products. This is a non-tangible and a software-based application of a solution for a problem which we just discussed. Difficulty in self-diagnosing symptoms and also accessing healthcare information. So, like we talked about searching on Google about the symptoms, we also come across so many things of the jargons that we are not aware of. So, if I have a headache or some issue which is very specific, if I search on Google, I will find a name which is another issue, which I'll have to again Google, which will lead to another issue which I'll again have to Google, and the number of tabs will keep increasing till I actually know what is the potential condition that I have, which is taken care of by this particular app that you're able to see on the screen. They have found this problem to be existing almost everywhere. And what they did was they used artificial intelligence to make sure that when you enter your symptoms, the AI understands what the symptoms are, and based on the database that it has, it basically tells you the potential conditions. It also gives you an idea about taking informed decisions, how whom to seek for medical attention, and what to say when you're going to seek medical attention to a health expert or a doctor. And this this app I'm talking about is not an Indian app, but there would be some Indian apps as well that are doing and working towards this particular problem. One of them I can think of is MFine. But if you know of any other interesting apps that are working towards symptom checking, do let us know in the chat. Um, the point of showing this particular case study was also to showcase that given we're talking about digital health so much, it becomes very common to see applications um, being run to meet the gaps in healthcare. Coming to the last question about which is very much close to my heart, which is related to cancer. And now, if like me, if you have anybody who has ever come across cancer treatment, or it could be your acquaintance, it could be anyone related to you or distantly related to you, um, you would know the challenges they might have faced. So I would like to again give you 15 seconds of time to tell us if you have seen someone facing any kind of a problem and what problems were they facing. So let's take a 15 seconds pause, and I'll tell you when you can submit your answers. Okay, 3, 2, 1. You can shoot your answers. Aditya says, yes, my grandfather had lung cancer. Last months were a challenge for him, like unable to eat, loss of weight, adhedonia, etc. Uh, Lack of accessibility, lack of awareness, says Dr. Shweta. Ankit Raj says medication cost and palliative care. True. Sakshi Sharma says getting clarity on how to take care of themselves. Yes. Which is also a part of the medication and palliative care. Loss of hair, weakness, etc. Also loss of hope, cost of treatment, um, financial crisis, lack of information, emotional breakdown. Nimisha Bhuyan says palliative care is a challenge, says Dr. Rucha. Dr. Ritesh says main problem is acceptance and then desire for treatment. I like how all of you are able to come up with different perspectives, be it emotional, be it psychological, or related to the physical being or physical appearance of one. Caregiver's burden. Yes, definitely. I like how you're thinking about other stakeholders in this, apart from the patient. Um, and it does increase caregiver's burden, given a lot of things need to be taken care of and in the right way. So the next case study that I'm going to talk about is related to this particular treatment and the challenges it brings. One of the challenges that it brings, and one of you actually also mentioned it in here: loss of motivation and lack of support from outsiders or society. True. Um, so the next topic or the case study that we will be talking about is about EVA scalp cooling system. One of you, I think Pallavi, mentioned about the hair loss. Some of you also mentioned about the emotional breakdown and the social support, lack of social support that is required. So all of us have known at least one person, I guess, who has faced this particular issue. And one of the very popular persons that had cancer and had hair fall was Sonali Bendre. And I'm uh, I'm sure a lot of people who would be going through this would be facing a lot of challenges with respect to their self-esteem, or the way they used to project themselves. It affects a lot when you have the very essential part of your body gone. So the reason why your hair loss happens is because of the medication, that chemotherapy, uh, that a patient under when he or she undergoes chemotherapy experiences, the drugs, chemotherapy drugs. What they do is they impact your hair follicles with a very high temperature, because of which they cannot survive or stay in place. To solve this problem, Eva Scalp came up with a solution, and the solution was a scalp cooling method, which happens to be practiced while the chemotherapy treatment is going on. And what it does is, because you cool your hair follicles or your hair scalp, the chemotherapy drugs which were earlier reaching your follicles and damage them, they are not able to damage them now. And which is why this product is also considered one of the very revolutionary products in healthcare industry. When it was pitched on Shark Tank, this was the third innovation in this particular domain. Um, and this EVA scalp cooling system is just one solution of many other solutions that the organization, that is the parent organization of this company, brings for healthcare. You should definitely check out their website. And like I said, it was also on Shark Tank, and a very interesting product for all of us to know about. Now, coming to the very interesting question about whether you guys have ever worked on any healthcare innovation projects before, and what was the kind of experience you had. We will pause again for 15 seconds, and you can shoot your answers at the end of it. Okay, three, two, and one. You can submit your answer if you have any experience in terms of healthcare innovation, any ideas that you had fiercely worked on. Agrima says not worked on healthcare innovation projects, but M-Health digital health interventions. Okay, interesting. Uh, Sharon Murali has said that cancer patients are already in a lot of financial stress. How affordable is this technology? Right. So in terms of the costing or the finances, Sharon, I would highly recommend you to check their website. I wouldn't be the best person to answer this, but you would definitely want to check it out on their website. Yes, I have worked on innovation projects, says Sharon, in the field of non-communicable disease care. It's good, but scaling the same is an issue. Right, right. So I in our team we have faced a very similar problem, Sharon, with respect to uh, products which are very much for special needs become very difficult to scale. Okay, cool. So working on ABDM, Pankaj is working on ABDM. I think it's Ayushman Bharat Digital Mission. Nice to know, Pankaj. It in itself has a lot of interventions and possibilities to do innovation. Tejashwari says using AI chatbots to detect anemia. Oh, nice, interesting. This is a very interesting project. If you have already worked on this, it would be very interesting for us to connect later on regarding how we can help you on the same. Um, okay. So, so having discussed all this, it becomes my duty now to show you what goes behind the innovation. What's behind the scenes that these innovations take place. Okay, there are more answers. I'll take two and then go ahead. Sakshi says, I didn't work on any healthcare innovation, but I recently learned that ASHA workers in Telangana are now using AI ChatGPT to address basic queries. Oh, yes, in addressing malnutrition in the community. AI tool is translated into their mother tongue language. Nice. Jaideep says, I have also worked on some projects and found acceptability among community and make it affordable and accessible is major challenge. Totally agreed. We work with one organization called Saathi Cares, Jaideep, and they are working to make healthcare accessible and affordable. Mohit Varyani says not worked on health innovation per se, but have tried innovative approaches to take access to healthcare. Dr. Ritesh says, I have designed voice generation device for aphonic patients and got Haryana Young Thinkers Award. Congratulations, Dr. Ritesh. That's a commendable thing. You might want to learn more about what we are going to talk about. It would definitely interest you. We support team and screen many POCT diagnostic and digital innovations, says Dr. Rucha. Okay. Non-invasive technology to detect anemia, says Pankaj Yadav. Okay, guys. I really love the enthusiasm in this crowd. Thank you so much for coming up with so many things. And I'm sure you guys, given that you guys are working towards this already, this session and what I'm going to talk about going forward is going to be of great interest to you. So let's plunge into it. Um, the essence of what the workshop is going to be or is all about, design thinking is all about, is human-centered design. Now, when I talk about human-centered design, uh, it's not a linear approach that one can follow. That okay, there is a problem, we'll go to the solution, and it is done. It's never that way. It is a very iterative process, and it takes a good amount of time to diverge, to converge in terms of problem and in terms of solution also. So the diagram that you're able to see in front of you is the entire process that the teams go through, which are collaborating to solve any challenge, a wicked problem. Okay. So as you see, they start at one point, which is the trigger point, in which they select a particular domain. They discover different challenges in that, and they converge towards one particular challenge, and then they come up with different solutions. They select one solution to prototype, and then they come to the potential solution. Now I know this is a lot of information for you to take in the first place, So I will give you an example from the previous case studies that we did. Okay. Let's take the toothbrush case study by IDEO and Oral-B. The trigger point was the difficulty of kids to use the existing clean toothbrushes that are used by adults. And given this was a problem not being solved by many people, this definitely had a scope of intervention. Now, how did they get to know that there are no other inventions done or nothing done in this aspect before? To do that, they need to do a lot of secondary research, which is the part of the discovery. And they diverge. When I say diverge, it means that they go into details of getting a good amount of information about toothbrushes, about the existing inventions in the toothbrush industry, about the way kids brush their teeth. So, like I said, IDEO not just got into designing a solution. They studied the whole activity that a kid goes through after he wakes up in the morning. He gets his brush in his hand and tries to brush his teeth. How does he brush his teeth? How he handles the brush? All those become part of primary research, and secondary research helps them to collect the information of what all already exists. Is this problem really relevant to be solved? Once they know that okay, this is a problem, there are stakeholders who are facing this problem about toothbrush, about brushing their teeth. So then they will define the problem. Then they will know, okay, I have data to back this problem. I have a scope of intervention because not many innovations have been done in this particular problem area. So what I will do now is I will define the problem and I will make it very simple for my team that okay, this is the problem we are going to work on, which is to make uh, to make brushing tooth brushing teeth simple for kids. Now, when I talk about this problem, we can't directly get into toothbrushes. There could be so many other alternates to this. One could have a tablet that goes in the kid's mouth and it could just dissolve with his saliva and he can gargle it later with his with water and um, rinse it. Basically, that could be one solution that they would have come up with. There could be other solution wherein the toothbrush in itself would have been eliminated and would be replaced by Listerine kind of a gel or liquid rinser. It could be a behavioral solution that would be an attempt to intervene as to how can we design a poster that helps children to hold the toothbrush properly. All these problems, all these solutions that I'm talking about are the part which one does in ideation, which is the reason why it is in the divergence is we don't constrain the team to when they come up with solutions in this part. You come up with as many solutions as you want, and there is no constraint of whether this is even possible practically or not. And once you have so many problem solutions, when you have so many solutions on hand in front of you in form of sticky notes, you would probably think that okay, I have now 15 ideas, I can't go with all of them, I need to get tested at least one of these. So how do I figure out which one is the best one? How do I get that validation is the step when you go into prototyping. And prototyping also has a part of it which basically lets you design the solution tangibly or intangibly. When I say design the solution, let's say you have a toothbrush, you can actually use foam or 3D printer to get that toothbrush design printed so that it can be user tested. This is what prototyping is all about. If it is an app, it could be a software that you design your app in, and your prototype becomes ready to showcase to anybody or to even get validation or feedback from the users. One thing which I missed out here in the discovery phase was empathy. Sorry about that. That is the core of the design thinking process. So whenever you are discovering the problem, the part where you spend time with users, whoever your stakeholder or user is, in this Oral-B case, it was kids. So it becomes essential for someone to stay with a kid to see what the how the kid brushes his teeth or her teeth, and also to document the entire process in terms of videos, in terms of notes, and taking insights further to come to the next stages of the process. And I'll also explain you each of these separately in the coming slides now. If anyone has any questions, we can take 10 seconds, and you guys can just type in. I will give you 10 seconds to type any questions you have for now. Okay, 3, 2, 1. Any questions, any doubts you have, which might have been difficult to understand? Okay, so I'll move to the next part, which basically explains each of these stages. The first one is the research, and I'm sure many of you would be already familiar with this part, wherein you do surveys, you take questionnaires, do observational studies of your stakeholders on the field, which is very important. This word on the field, because many of the people, they only do secondary research and they fail to do the primary part of it. Primary research is as important and even more important than the secondary research. What primary research is essentially, for those who don't know, is essentially you spend time with the person that you're solving the problem for. It could be kid in terms of oral B, it could be someone who is facing difficulty in identification of their veins during a blood donation. It could be someone who is googling their symptoms of the diseases. It could be anyone, the user basically, who for whom you are solving the problem. You need to spend time with them to understand what is it that is actually the need, uh, than their wants, or what is it that you have a bias on, which might not ideally be the exact problem on the field. And then why research is needed again, the secondary research is to figure out whether there is an existing solution to any of these problems, whether what problem I'm trying to solve is actually a big problem. So like someone mentioned, someone wants to design non-invasive technology to detect anemia, to find out whether anemia, how prevalent anemia is. It definitely is a problem, we all know, but how prevalent is it? How many women in India are facing this particular challenge is what secondary research will help you. It will give you statistics so that when you are going to propose this problem and solution, the person standing in front of you will definitely want to know that is this really a problem? What is the significance of this problem? How big is this problem? So to make it easy for them, you will need to back your research with some kind of a data, which only secondary research will be able to help you. It will also be able to help you to understand what existing innovations exist. What are the existing innovations in healthcare problem that you're trying to solve? Um, okay. Someone has said, please explain define phase again. Yes, Nimisha, I will come to that in the next slide itself. Coming to the defining of the problem, like you asked. Like I said, the problem that you're trying to work on, let's say, for example, you're trying to work on a problem with respect to the kids in the previous example, and you want to improve their brushing techniques or improve or want them to brush daily. Let's say, to put it in a very simple way. Now, this problem is a little bit vague. There could be so many ways to think about this problem. But the moment you say that, okay, I want the problem, I want to solve the problem of toothbrush or design of the toothbrush, I want to redesign a toothbrush, that becomes defining the problem. So now you know that your problem statement is not a very big scenario, rather, it is a very small thing. I'll give you another example. If you want to solve problem of air pollution, which is in itself a very wicked problem, you cannot directly solve air pollution. You will need to narrow down your research into one domain. It could be air pollution by emitted by the vehicles. It could be air pollution generated by factories, or even the pollution which is generated by other stakeholders. So, food industry, for example. So when you start defining what area you want to go deeper into, that's when defining helps you. And it also helps you to generate solutions which will be coming in the later stages pertaining to solving only that problem at hand. So that's what essentially defining the problem essentially means, to narrow down the problem. I hope Nimisha, I have been able to solve your doubt there. Getting to the next phase, which is the ideation. This is the most interesting and the fun part of the entire design thinking process. And the reason it is fun is because you don't have to do a lot of research. You don't have to get into the laptop and read research papers or articles. All you have to do is doodle. All you have to do is write down things. You can sketch out your ideas. You can paint your ideas. You can write down on sticky notes, stick them on the chart paper or the wall, and there is no constraint at the initial part of the ideation. Nobody is going to tell you that, okay, this is not feasible, this is not possible to do. That's the later stage to come. So this is the part wherein you can come up with hundreds of ideas or even more, as a team. And to come up with different ideas, of course you would not be able to do it alone, and that is why this entire process is done in teams, through collaboration, because everyone has different perspectives. And while we were talking about the challenges, we also came someone said that everyone has different perspectives and different backgrounds to contribute towards healthcare innovation. And that's where actually the team or the collaboration approach is the only and the best way to go about this particular phase or the entire design thinking process in itself. And once you have all the ideas on the paper laid out, you know that, okay, these are the 10, 15 ideas I have as a group in mind, we have as a group in mind. And the next task becomes the convergence part, which I explained you in the earlier diagram, wherein you converge to one or two solutions for which you will be going to test it with your users. And that stage is called prototyping. The reason it is called prototyping is because your solutions become alive or get into existence after you have figured out that, okay, this is my solution, this is what I want to do, but I don't have anything to show that, okay, this is my output. Now that output should be either tangible or intangible. When I say tangible, it can be touched. It is a product that has a material that can be felt, like in the previous case study, the toothbrush or the vein tracer. All those were tangible products which someone could touch and feel. The other side is the intangible products, which are basically apps or softwares, which again solve solutions in their own way. And when we say about apps or when we talk about products, um, you cannot directly come up with a final product or an app. You need to do a frugal prototyping. When I say frugal prototyping, what it means is, it basically means you have some resources at your hand, and you use those resources which are available to you to come up with some solution. If your solution is very much intangible or it requires even materials which are not easily accessible, then you 3D model it, or you use softwares which are accessible to you to design wireframes. Wireframes are like the basic models of the websites, the basic sketches of the website or skeletons of the website and applications. Um, so now, and after you have something in your hand, you get to testing it with the user. I'll take some questions here. Um, so Megha Rani says, so do we test all the ideas that have come from the group, or is there a criteria where you screen ideas? Yes, this is a very interesting question. Thank you for asking me, and I missed it by mistake. So there is something called feasibility, viability, and desirability Venn diagram, which will be included in any design thinking workshop. What that says is, your solutions, you have many ideas, but not all ideas are feasible. Not all ideas could be desirable by the user. So which idea is actually desirable, feasible, and viable? Viable means it is something you as an entrepreneur or designer can make it. Feasible means it is something that your user can buy it. And desirable means it is useful to the user at the end of the day. Because if it is not, if it doesn't fall in these three domains, then your idea wouldn't work. So that is how, Megha, we decide or validate an idea. Um, is financial viability, sustainability also considered inherently at the ideation stage? I believe financial resources would be key here to be able to move to the prototype stage. So, Agrima, the ideation part does not involve it. Reason being, if we stop someone from thinking ideas in a very initial stage, they might not come up with some ideas which could be made feasible later on. So, if I say, for example, I want to design something in terms of what is it called? Augmented reality. So if you had thought of it earlier, it was always not feasible or not practical. If you go years ago, but today we see those things coming into life, right? Augmented realities, VR glasses are pretty much there out in the market. So that's why we don't stop at the ideation stage. But yes, there are ideas which at that point you want to get user tested because we all work within our timelines. You would be doing some innovation based on some incubator program, or even if it is a design thinking workshop, you would have a limit of time. And within that time, you will need to figure out whether this is feasible or sustainable or viable or not. If that works, then you can go ahead with it. I hope, Agrima, I answered your question. Um, and the very next question, of course, would be if we uh, conduct a workshop on design thinking, would you guys be interested in it? We are planning to do an in-person workshop, in-person design thinking bootcamp with Yod and Saathi Ventures. So this is an open call for all of you, and also give us the validation now whether this is something that would interest you. And I would also want Pallavi to come in here. Um, yes, this is the
Great.
poll.
So, yeah.
Yeah. Yes, yes. Go on, Pallavi. I'm sorry.
So I just quickly launched this poll with like three questions, simple yes or no questions, in case you guys could take a look at it, give us what you think, let us know of your interest. So then we can see that if we can, extend this introductory session on design thinking to a more, to a more elaborate boot camp on the same. And there we will get a chance to, ideate, work on prototypes, learn different kind of softwares potentially, and see how these ideas can actually come to life. So yeah, so we are actually receiving great response. Wonderful. I'm not sure. Are you guys able to see the results as the responses are live? Okay. So I can tell you. So far about 47% of you have voted on the poll, and out of which 94% of you have said that yes, you would like to attend an offline design thinking boot campaign. Um, Most of you would prefer it over the weekend, and Delhi and Bangalore right now are the preferred locations for doing this boot camp. Um, just 10 more seconds in case any more of you want to, vote on the poll, and then we could close that. Perfect. I will quickly close this now. I see if people have messaged. They also want to quickly vote. Okay, I will end this now. I am sharing results with all of you. I hope you guys can see it. Perfect.
Someone
Over
has
to you.
someone has said not able to see. Nimisha is not able to see. Nimisha, you can answer it in the chat if you would like to be a part of it. And which preferred city would you want it to be? Okay, now it's done. Great. Pallavi, should I take them to the next part?
Yes, please.
Okay, okay. So guys, thank you for the responses. Just to walk you through about what overall the design thinking bootcamp looks like, I'm sharing in front of you a screen which has the 3-day model. Now, we don't have only 3-day models, we also do 5-day models, and we customize them depending upon the requirement and the batch that we have. Just to give you an idea what a 3-day model looks like is in front of you. We start day one with design thinking introduction. We also, like I talked about, empathy building and understanding user needs. Day two is about defining the problem that you have chosen the domain to solve for, ideating, coming up with iterations. And the third one is where you learn different applications of, different ways of getting your solution to life, be it 3D modeling or prototyping. And we end the workshop with a final presentation. Um, the interesting thing about this particular boot camp is that what you are seeing, each of these uh, pointers, or I would say each of these stages, they are not like lecture based stages. We don't lecture in any of our sessions. Everything is interactive and activity based. So, for example, I'll give you one basic example. In empathy building activity, we also do role play, wherein I will give you an example of a very recent bootcamp that we did in Manipal Dental School. And there, what we did was we gave them different scenarios. One of them was, imagine you are a you are a pregnant lady, and you have treatment. You have a tooth treatment to be done. You are new to the city, and you have your husband, which is the nearest caretaker for you, and you want to get your tooth treatment done in that city. So how do you navigate through this problem? So this was a scenario-based role play, wherein your team, and again, if I missed to say this, this will be a team activity. The whole boot camp will not be a single person participation. It will have teams so that you can collaborate and discuss it between yourself, brainstorm between yourself. And reason being, it to put it in the teams is because all of us come from different backgrounds and different perspectives, and of course different ideas to contribute to any kind of design solution. um, and the example that I gave you about the role play, it is a very interesting activity which I'm sure all of you would love to do. And that was just one activity. We also have activities wherein we give you products that we use in a daily life and you can actually touch and feel them and talk about what you feel that this product lacks in terms of the design and how can you make it or improve it to make it better. So all these things are included in the in different stages, and we try to make all stages activity based rather than just a simple lecture, than which a lot of schools and colleges do. So we avoid that in our boot camps. And the other thing which I already said is it is a very much customized boot camp based on the people or the the audience we get for the same. Um, and the age group is also something that all of you can come into, be a part of, and get a lot of insights from this kind of a boot camp. And having said that, I would also like to draw your attention to what is in it for you. Why would you really want to attend this boot camp? So these are some expected outcomes. You can come up with some solution and pursue research. You can even publish papers or patent your solution. The workshop that we did in Manipal, out of the 10 groups that we had, 4 of them came up with patentable solution and 2 came up with application based business ideas. So that is the potential of this boot camp. Coming to the access to incubators, with the network that we have, we would like to help you get access to bio incubators, which are government funded, like BIRAC, TST, etc. Um, Networking is another interesting takeaway from the whole workshop. You will not be alone. You will be with a lot of people. You will also be interacting with founders and healthcare experts throughout the workshop. The possibilities of doing internships. So we do have organizations into healthcare innovation within our network and ecosystem, which we would want to connect you, given your solution falls into their purview. And that could lead you into great internships, especially for the freshers or the people who are very new to innovation and entrepreneurial practices. You would really like to have internships and even mentorship. So these are like seasoned professionals coming from different backgrounds of entrepreneurship, public health, business management, and academics as well. And we would want you guys to come in touch with them for a longer relationship. We are not looking this workshop to be a 3-day event. We are looking to build relationship here so that post the workshop also we stay in contact, or at least you get in touch with bigger organizations which will help you take your ideas further into fruition. Um, and I would like to thank you for your patience and your enthusiasm. If you would like to reach out to us, you can reach out to us at info@designforimpact.co.in. And if you have any questions for us, we would like to take them now. There is no timer for this. Aditya
Great.
says thank you. Yes, yes, Pallavi.
We are seeing people's feedback coming in. Megha says that it was a fruitful session. I was also speaking to a few participants on the side on DMs, and somebody said that the sessions were fruitful and they enjoyed it, and they think that we should definitely be doing an extended version of this. So, guys, we will definitely let you know of when this extended version is happening. We will, figure out dates. We will let you all know, and we will definitely, maybe send all you guys, maybe a form to fill out to understand that, what exactly would you be looking at in a session like today's, if it's an extended form of it. So do definitely stay tuned and connected with Yod. We will be coming with lots more webinars and workshops of similar nature around digital health and public health at large. And we would love for all of you to participate in that. In case you're not members, then you can just log into our website and become a member. Sakshi has also shared a link in the chat. And we will definitely love to curate an extended version of this design thinking for healthcare workshop, and we will keep you guys updated. So once again, thank you so much for joining, and I really appreciate you guys taking out your time over the weekend and coming together, and hope to see you guys soon again. Thank you. Bye bye.